Hello, welcome to this talk on beta blockers. So we'll go through beta blockers, we'll discuss its mechanism of action, the uses, its absorption and distribution, metabolism and excretion, receptor selectivity, and the effects. So firstly, the mechanism of action of beta blockers. Beta blockers work as competitive antagonists on beta adrenoreceptors, and ideally a beta blocker will be selective for beta 1 receptors. Beta 2 receptors are contained within the lungs, and blocking these receptors can precipitate bronchospasm. So the uses for beta blockers, as seen on this whiteboard here, the uses can include hypertension, in angina, in tachycardias, in order to obtund the laryngeal reflex, in hypertrophic obstructive cardiomyopathy, anxiety, and in migraine. So the absorption and distribution of beta blockers. Beta blockers with a low lipid solubility, for example atenolol, are poorly absorbed in the gut. Therefore, these will preferentially be given via the IV route. Beta blockers with a high lipid solubility, for example metoprolol, can be given orally. However, these have increased CNS side effects as they are more able to cross the blood-brain barrier. So if we look at the metabolism and excretion of beta blockers with a low lipid solubility are freely excreted in the urine, and those with a high lipid solubility undergo more hepatic metabolism. So as we discussed before, with beta blockers we are aiming for receptor selectivity of the beta 1 receptor. And beta blockers with known receptor selectivity for this receptor include atenolol, esmolol, metoprolol, bisoprolol, and carvedilol. So now discuss the effects of beta blockers. So the intended effect, and the one we usually want, is the cardiovascular effect. So beta blockers will increase diastole and reduce oxygen requirement of the myocardium. However, they can also reduce the performance of a poorly working ventricle. Beta blockers are both negative chronotropes and negative inotropes. In terms of the respiratory effects, we may get unwanted beta 2 blockade, which will result in bronchospasm. Beta blockers can cross the blood-brain barrier, so we can get CNS side effects, which will include hallucinations and drowsiness. We can have GI side effects, including dry mouth and GI upset. And in terms of the metabolic effects, it can increase the resting blood glucose in diabetes. Thank you for watching this very short whistle-stop tour of beta blockers.